So I'm sure you're wondering what will happen after surgery. A lot of patients, when they come in here for the procedure, they say, okay, how much time off do I have to get there? The answer is none. Really, the day of your procedure, you really probably won't take that day off because you've got all these numbing medicine in your leg and the bandage. But we actually don't want you to rest. We want you to walk. We want you to walk as much as you can, at least an hour the day of your procedure. We don't want you to go and do weightlifting or do really heavy duty exercise at probably up to 1 week after your procedure. But essentially, you can do all the other activities. Now, if your job involves lifting large amount of weight, obviously we don't want you to do that for the first week after the procedure. Some patients get a little confused. They say, okay, so 1 week after my procedure, remember, depends how many bad veins you have and how many procedures you need to have. So try to plan on, about 1 week after your last procedure. Now, before I forget, you cannot fly within a week after you've had a procedure done with the laser. And if you're planning to travel on the road, I really like my patients to be around for a week after the procedure. So if you have any questions or any problems, or there's some areas that don't look good or feel right, I'll have the opportunity to examine you. Otherwise, you're going to be examined and seen by another doctor somewhere else, which I'm not sure what the knowledge of vein disease. It is a super specialty. I've got my boards in general surgery. I also have my boards in venous disease because it is, I believe it is a super specialty. And you might end up going somewhere where there is not a specialist and they might get all confused about what is happening. And so I really like patients to be around for about a week if we can. Now we will work around your clock, around your time. So I've had patients who have had their lasers and they want to go on a vacation, they come back and we finish their injections. So essentially, there is no pain after surgery and there is no recovery. There is also another common question the patients have, is this going to come back? Well, we don't, the veins that I've treated, there's a good 98-99% closure rate. We haven't had them open up, but remember the body has other veins and other veins can get diseased and need treatment. But just because the other veins could potentially get diseased doesn't mean you shouldn't have the main area treated. You're still better off having it treated because the longer you wait with venous insufficiency, the more damage it's doing to your body and the more long-term complications you're going to have. And if we see you very early on, the chance of having your tissue getting back to normal is very high. Whereas if you wait till your skin is almost leathery, black, dark discoloration, that might never come back to normal. So please seek help earlier, and even if you just don't want to have any procedure done, at least keep the conventional stockings so that they can help you. And there's two things I've always got mixed feelings about talking about. One is the risk of clots. The risk of having clots is high when you have venous insufficiency or you have varicose veins. The reason why I don't want to go out there and talk about it too much because I'm worried that everybody who's got a little varicose vein might be worried about getting clots. But by the same token, we can't ignore the fact that if you have varicose vein, you're at a higher risk of getting clots. If you go through surgery, your hernia, gallbladder, hysterectomy, or hip surgery, and you have varicose veins, you are at higher risk of getting clots. So you're probably better off having your veins done first before you have your hip surgery. So varicose veins are associated with an increased risk of clot. And then, of course, there is a risk of the veins rupturing or bleeding, and we've had quite a few of those, and when they bleed very heavily because there's a lot of pressure inside the vein at the ankle. So we certainly, by having it done earlier, hopefully will avoid you having bleeding issues. Or have patients who are on blood thinners later on, and now you've also got venous disease. By the way, currently, even if you're on blood thinners, we can close those veins without stopping your blood thinners, so we don't increase your risk of going without blood thinners when you're having a procedure, because there's no cutting involved. It's all done through puncture sites and there's no bleeding afterwards. I believe that should pretty much reassure you about your recurrence and recovery. However, I would strongly recommend that once you have your veins done, at least come back and see me. If not anything, a social visit every 3-6 months, maybe once a year, so we can check you, make sure nothing new is developing. If it is, if it's treated early, hopefully it won't be much of a treatment and it will be very easy to take care of. Thank you.
Scarless Vein Care by Dr. Kamran. Call for your free consultation and learn more at scarlessveincare.com.